Welcome to This Explainer. Today, we're diving into a really dramatic collision in American history. We're talking about this wild yet super tragic intersection where deep personal tragedy just slammed right into towering bureaucratic ambition. And honestly, it's a collision that literally created the modern mental health system as we know it today. Let's get right into it.
So here is our roadmap for this historical detective story. We're going to cover 1, a tragic family secret, 2, the bureaucrat's grand vision, 3, exposing the snake pits, 4, the mental health lobby, 5, the political collision, and finally, 6, death of the asylum. We are tracking how these completely disparate threads basically wove together over 2 really turbulent decades. And our source material for this explainer is the deeply researched book American Psychosis by Dr. E. Fuller Torrey. It uncovers this stunning paradox, how a system that was genuinely intended to save our most vulnerable citizens actually ended up setting the stage for a modern disaster. Which brings us to where our story actually kicks off. Fall 1941. It's a chilling butterfly effect, really. In September, a young woman named Rosemary attacks her grandfather. By November, she undergoes this brutal brain surgery in Washington, D.C. And at that exact same time, literally just 40 miles away up in Baltimore, a bureaucracy is writing his master's thesis. Those 2 events, separated by a quick drive, laid the groundwork for a massive shift in public health.
All right, Section 1, a tragic family secret, the Kennedys' hidden struggle. Let's look at the deeply personal, heavily guarded narrative of one of America's most famous families.
Let's look at the incredibly tragic progression of Rosemary Kennedy's life. She was born during the 1918 influenza epidemic, which we now know is a risk factor for later developing schizophrenia. As a kid, she suffered from mild mental retardation, and her incredibly ambitious father, Joe Kennedy, fiercely protected this secret to maintain the family's perfect image. But by the late 1930s, things got worse. She started having these violent rages, even physically attacking her powerful grandfather, Honey Fitz, and she started sneaking out of her convent at night, just wandering the streets. This completely terrified her socially ambitious, deeply Catholic family with the absolute nightmare prospect of an out-of-wedlock pregnancy.
Desperate to keep things under wraps and find a cure, Joe Kennedy turned to Dr. Walter Freeman and Dr. James Watts in the fall of 1941. They performed a prefrontal lobotomy on Rosemary, and the surgery was an absolute unmitigated disaster. It reduced this beautiful 23-year-old woman to an infant-like state. She couldn't speak coherently anymore, couldn't wash or dress herself. Heartbroken and horrified, the family basically banished her, hiding her away at an institution in rural Wisconsin for decades. It was this massive family sin that would demand some serious political expiation years down the line. Moving right along to Section 2, the bureaucrat's grand vision, Dr. Robert Felix's master plan. We're hopping from the Kennedy tragedy in D.C. over to the bureaucratic track in Baltimore.
The absolute crucial point here is this vision crafted by Dr. Robert Felix. He was this highly charismatic public health officer who wrote a thesis proposing a totally radical master plan. He basically wanted to entirely rip out and replace the existing system of state mental hospitals with a massive network of community outpatient clinics.
Now, we have to pause here and understand just how radical this sounded back then. Caring for the mentally ill had strictly been a state responsibility since 1766. Past presidents literally viewed federal meddling in state charity as completely unconstitutional. But Dr. Felix? He wanted to use federal power and federal money to completely rewrite the rules of psychiatric care from the ground up.
Which leads us to Section 3, exposing the snake pits, the collapse of the state asylums. You see, to push a radical plan through, you really need a crisis. And right after World War II, a massive PR disaster handed Felix the perfect catalyst. 558,922. That is a staggering number. To put that in perspective, that was the peak population of patients housed in state mental asylums by 1955. The entire system was just bursting at the seams.
And the conditions inside? Horrifying. During the war, idealistic, conscientious objectors had been assigned to work in these state hospitals. They were appalled by what they found, exposing environments they literally compared to Dante's Inferno. This all blew up in a sensational 1946 Life magazine exposé titled Bedlam. It featured these shocking photos of naked patients huddling in damp, unfurnished rooms, state budgets were buckling under the costs, and the public was finally shocked into paying attention.
That brings us to Section 4, the Mental Health Lobby, a campaign to change America.
Sensing his moment, Robert Felix pounced on this crisis. He didn't just write academic papers, he built a political machine.
He found this incredibly effective partner in a guy named Mike Gorman. Gorman was a crusading journalist turned relentless Washington lobbyist, and he was bankrolled by wealthy philanthropist Mary Lasker. Gorman just despised the state hospital system. He actually admitted his hidden agenda was to entirely break the back of the state mental hospital.
Working together, Felix and Gorman drove the creation of the National Institute of Mental Health, and through just relentless lobbying, they exploded its budget. I mean, they took it from $9.2 million in 1950 to a whopping $67.5 million by 1960.
But here's the catch. What were they actually funding with all that money? A concept called mental hygiene. The source points out the sheer hubris here. Relying on completely unproven Freudian theories, Felix and his colleagues genuinely believed they could prevent severe brain diseases like schizophrenia just by treating minor childhood behavioral issues and tweaking the social environment. Basically, they thought they could fix society and cure severe mental illness through PTA meetings and community clinics. It's kind of wild to think about.
All right, Section 5, the political collision. A president's guilt meets bureaucratic ambition. Let's bring these two tracks together. The Kennedy tragedy and the bureaucratic machine finally slam into each other when JFK takes the White House in 1960.
Almost immediately, this fierce political turf war erupts. On one side, you've got the mental retardation advocates, led by the president's sister, Eunice Shriver. Driven by deep guilt over what happened to Rosemary, Eunice commanded federal attention, and frankly, she viewed psychiatrists as pretty much useless. On the other side, you have the mental health advocates, led by Robert Felix. Now, Felix had been waiting decades to expand his psychiatric power, and he deeply resented being sidelined by the Kennedys' focus on retardation. It was a massive clash of egos and agendas.
Right in the middle of this political fistfight, an ironic twist changes the whole game. A new drug called Thorazine. Introduced in the US in 1954, it remarkably reduced delusions and manic symptoms. It actually worked. And because it worked, it gave Felix and Gorman the medical fuel they needed to justify emptying the asylums. For the first time in a century, the hospital census actually began to drop.
And that brings us to Section 6, Death of the Asylum, Erasing the State Hospital. We've reached the climax of our explainer, where a committee basically seals the fate of the entire American mental health system. Robert Felix helped orchestrate a joint commission that produced a report essentially laying out his exact 1941 dream. The playbook went like this. Step 1, declare the state hospitals bankrupt beyond remedy. Step 2, inject massive federal funding to yank control away from the states. And Step 3, build one community mental health center for every 50,000 citizens. This quote from Dr. Stanley Yolis, a key architect of the policy, really says it all. He wanted the eventual disappearance of the state hospital. But here is the most shocking part, all right? The committee of bureaucrats who decided to totally dismantle the state hospital system had almost zero actual clinical experience working inside them with the severely mentally ill. They were public health theorists, not practitioners. So, the huge takeaway from Torrey's analysis is just the sheer scale of this policy shift. He argues that driven by a family's desperate need to expiate the guilt of a botched lobotomy, combined with the towering hubris of bureaucrats who thought they could socially engineer away mental illness, America embarked on this sweeping utopian experiment. They destroyed a flawed but totally necessary reality, the asylum, and replaced it with a completely untested theory. Which leaves us with this final provocative thought. By tearing down the asylums without a proven, functioning safety net in place for the most severely ill, did our grand attempt to rescue the vulnerable actually just abandon them? Because when you walk down the streets today and observe our modern crisis of homelessness and untreated mental illness, you are looking directly at the legacy of this exact history. Thank you for joining me on this explainer, and I really hope this leaves you asking even more questions about how we care for those who need us most.